People ask me all the time, how do I find a good doctor? First of all, word of mouth. You need to talk to people that are friends of yours that number one, they should be picky. They shouldn't be like, oh yeah, everybody's great. They should be like, yeah, that person wasn't so great. That person was okay. That person was average, and that person's legendary. That's the people you wanna go to. The ones that they go, yeah, maybe they don't pay cash, but they would be willing to pay cash. But the best case scenario is where they actually do pay cash, because it's not like they're saying, oh yeah, I'd pay cash. They're actually paying cash. So it's easy to say, yeah, I would, but they already are, right? They're paying cash and you're seeing results. They went from this to this. Their health went from here to here. They went from feeling this good to feeling this great. Not just that they go there and then they get transformed into something, but that the doctor teaches and educates on what it is they need to do. So they're not always dependent upon going to the doctor, or they're going to the healthcare provider. Just put it that way, healthcare provider, that's the only way they feel good, because then it's just a crutch, right? We don't want them to be a crutch for us. We want them to be someone that pulls out the greatness that we have inside of us and the knowledge that we have. And we all have this intuition. We know what to do. We know our bodies. Here's what I tell my patients. I know anatomy and physiology better than you do. Yet, I don't know your anatomy and physiology better than you do. And that's where I think we go wrong, because we learn this in school. We learn about anatomy, we learn about physiology, that we go, okay, I know more than Johnny knows about his body, or Karen knows about her body, versus, well, I know all that stuff, but then how does that apply to Karen? How does that apply to Johnny? I don't know. Sometimes it does and sometimes it doesn't. There's sometimes people get symptoms that make a clear-cut case for X diagnosis, and there's other times you go, man, it could be a myriad of things, and that's what we call a working diagnosis, right? Or a differential diagnosis. It could be all these different things. And as you get through and you start treating, it's one of the reasons we call it practice, right? Is then you start to change that instead of doing the same thing over and over and over. And a lot of people do that, whether they be chiros, PTs, massage therapists, psychiatrists, general practitioners, orthopedic surgeons. We always have to be willing to listen to the patient and then go down the path that we think that they need for that day. Because what I do today might not be what I do tomorrow, might not be what I do the third day. And so you have to be willing to be open and really assess what's going on with the patient. Because sometimes they come in, it's an emotional component, and then the next day they come in, that's not there anymore. Now it actually is a physical problem. And then they come in the next time, and then you got to work more on the physiological part, and then on and on and on. So if I piqued your interest at all, then you should give Sports Docs a call. If you believe that I'm the one that can help you get where you want to go, wherever you are, could be way up here, could be way down here, but you want to be even better than you were, then you should give me a call. You should give me a call to see if we together, working as a team, can get you where you want to go in this life.